if you're on the fence for possibly considering Mommy Makeover, Yasmin has all the experience that you might want to learn from to help you make that decision. All right, welcome everybody. So we're back on the FITDOC podcast, and I have a very special guest with me today, and her name is Yasmin. And she's one of my patients, and she has a very, very, very unique story, very inspiring story. And she's also going to kind of help explain to everyone who's considering cosmetic surgery, specifically the Mommy Makeover. If you're on that fence, it's just overwhelming. What kind of, what decision you'd be thinking about, what to look in a surgeon, about the anesthesia, like what it means to have that procedure done. And so I think she's a great example of why some women might want to get a Mommy Makeover. And so, just kind of get started with you.
Thank you.
I've always been a fan of yours.
Thank you.
I've always been a huge fan.
Right back at you.
Yeah. So when we first started working together, I obviously looked you up on social media.
I'm there.
And she's a very inspiring role model for women.
Thank you so much.
And so her journey, I'm not going to take any of your thunder, but I think your journey is fantastic. Just super, super inspiring. It just seems to me that you something just clicked, and you just decided, I'm going to get into, start taking care of myself a little better, eat a little bit better, start exercising more consistently, right?
Yeah. I mean, I was overweight for my entire life.
Yeah.
I think it was probably 8 years old.
Wow.
Up until 26 is when it clicked, like you said.
What was your peak? I'm kind of curious.
250 was my highest. I'm 5'3".
Mm-hmm.
And I wasn't a lot of muscle definition or tone, so we can't attribute it to a lot of lean mass. I just basically grew up with a lot of unhealthy eating habits, and I carried that on into my adulthood. I struggled for years with my weight. I mean, I did any and everything. I grasped at straws too.
You're like doing
Desperate.
these crazy fad diets
and fad diets, disordered eating, just things that it was a really dark time in my life.
Mm-hmm.
But what clicked honestly is having my son. My middle son has Williams syndrome, and he's going to need me his whole life to take care of him.
Mm-hmm.
And so I really just had to get healthy for him. I had to.
Yeah.
I was I told you I was 250. I was just unactive. It was just not the place I should and needed to be. So I started exercising. I really didn't know what I was doing with the diet, but I knew that I needed to not sit around and eat Doritos while I was watching TV. I knew I needed to kind of start making some better habit changes, and it led me to losing 100 pounds.
Incredible. How long did that take you?
So I think...
Because some people I feel like, Yasmin, that they feel like it should happen within 6 months. And that's one of my biggest problems with our society now, is that people, it's like the McDonald's society. They want it like right now.
Yeah.
And just to do it right, it just takes time.
To do it right, I'm still doing it.
Yeah.
So it's a forever thing.
Yeah.
Especially when you're someone who struggles with it, as a lifelong kind of thing.
Right. Did you just do something? Did you just look on the internet and start figuring out what to eat? Did you reach out to somebody before?
Oh yeah, personal trainers, thousands of dollars. Never got anywhere with them, but I honestly just kind of over-exercised, unfortunately, myself to it, which led me to becoming a personal trainer and a nutrition coach, because I said, this isn't the way. Yeah. I was still overweight, even though I had lost so much weight. Wow. I still was a lot of body fat, so I said, I still am not where I want to be, even after I've lost all this weight. Mm-hmm. So I turned around and put on 20 pounds of muscle, and I'm, at so much better place physically, mentally, but then pregnancies, stretch marks, weight loss, loose skin, it wasn't going anywhere.
Yeah. No matter how much exercising, those are no magic creams. Let's tell my patients there's no magic creams, there's no magic laser.
There's nothing that's going to do it.
At some point, there's just going to be extra skin, and then, your only option is to remove it if it's really bothering you. But
oh, yeah, which it was. It was, because I felt so fit. But then I had this, loose skin everywhere. Yeah. And then breastfeeding, I had, no more breast tissue left from what I had. So it was like, I can either stay being unhappy or make a change like I did in the first place. Like I didn't have to sit there and be unhappy with something that was fixable.
Sure.
Right? So I started researching.
Yeah. And I think, I tell women a lot when they come in and, talk to me about considering mommy makeovers that I feel like you deserve it. Like, especially if you have children and you've gone through all the weight loss, kids or no kids, but then you have all this extra skin, all this hard work. You want to show it off. You want to fit better in your clothes. You want to be, just kind of show off that new confidence you want to have. And I think that's where these procedures really kind of come into play. So, once you decided and you told your husband, like, we're doing this, right? And I'm sure he supported you, right?
He was there 100%. He said, whatever you want to do, just, make sure you find a great doctor to do it for you.
Cool.
Yeah.
So how did you start your search?
That is, I started it a couple of years ago, actually, and I had 3 consults in person. 2 of them were in California in Orange County. One of them was actually from a really popular social media like surgical center that does a lot of those snatch transformations. But it was just really impersonal. I only saw a surgical consultant. I would have had to choose my doctor pretty late, close to the surgery, I should say, so I wouldn't have really been able to research the doctor much, and it just wasn't for me. And when I found out we were coming to Houston, we move around for his job a lot. I had lived here previously and had already done some research on you, and I said, it was fate. It was fate. So I basically immediately got a consult with you, and out of all 3 doctors I saw, none of them recommended a body lift except you. You immediately noticed that not only did I need the mommy makeover, the tummy tuck, but I had lost a lot of weight.
Right.
I needed more than just a standard mommy makeover.
Right.
And, had I gone with another doctor, I wouldn't have the results that I have, that I'm just, so amazingly happy with.
Well, glad to hear that. One quick topic that I want to, you just alluded to is you met with 3 surgeons, basically. And some women ask, like, how many surgeons should I interview or go visit with? And, my coordinator, Linda, Linda, right? And she and I both agree it's usually about 3 surgeons. You want to have, good conversation with 3 surgeons. More than that, it becomes a little bit too much. It's a little bit overwhelming, a little bit unnecessary. Obviously, it becomes costly if you're paying for consultations. But I think within three surgeons that you obviously researched ahead of time, looked at the website, looked at their photo galleries, looked at their reviews, those kind of things, I think you could make a good guess. But, when you visit with the surgeons, I think, it's, I tell all my patients, it's a relationship. It is very much a relationship. You're going to be seeing this guy or girl, surgeon, fairly frequently, and it's their job to make sure you get a safe, great result, right? And so I take that very personally as a surgeon and as my patient, as you know, and you went through the experience. But it's a relationship and it's a fit. So I think meeting the surgeon, not just like the coordinator or the consult that has not the surgeon, and showing up to the day of surgery and you get to meet your surgeon, it blows my mind. It just blows my mind that women are signing up for that. I just do not understand that.
And this is, it seems like such a quick thing because maybe you watch an Instagram video of someone's like quick, but this is like a lifelong thing. You want a surgeon who is going to be there and not just randomly choose one. You want to pick one. You also mentioned, the fit for the patient, but it's also a level of educating the patient that really, I feel like, helps me click with the doctor.
Sure. And
the level of education you not only give to your patients, but to people who are contemplating being a patient or just anyone out there who's watching your videos. It's so important to feel confident into what you're going into this procedure. You aren't feeling like, is this normal? It's already stressful enough.
Sure.
And then just the level of educating your patients, I think you do a phenomenal job.
Well, thank you. I tell my patients also it's a life event. This is a huge life event for moms or people who have lost a lot of weight. And so the idea is you want to have this surgery safely And so one-time shot. You want to do it one time and not have to go back for any kind of reasons, if you can avoid them. So, really having a surgeon, answer all your questions, educate you hopefully ahead of time before you actually get to the consultation with your coordinator that you discuss with all the questions. Like Linda pretty much knows most everything I know.
Oh yeah, they're so great.
So I always tell my patients, after you meet me and you have any questions, please reach out to Linda and Rachel and my team, because they've heard pretty much every question you can ever think of.
And I'm sure if they aren't sure, they know exactly who to come.
You know it. But going through the consultation process, and I want to allude to this, kind of touch on this topic too, is that COVID changed everything for us.
Oh, I bet.
And so this new virtual consultation phenomenon started happening. So I started off in virtual consultation almost immediately, just because we couldn't see patients anymore. It's I would say it doesn't replace seeing someone in person by any means, but in some instances I can see and make a pretty good assessment just by seeing pictures of people now. And kind of getting ideas, and this is what I want to do. I'm considering this and this and this, and I give you an idea.
Yeah.
But it doesn't replace, actually, at some point I got to see you in person,
right.
And so it gets really close. Did you have any? You said you maybe had one.
I did. I had. With you. Are you saying the virtual consultation?
No, just a surgeon.
No. Having a consultation with a surgeon. I had three.
Virtually.
Oh no. I had a virtual consultation first with you, but then we set up an immediate follow-up consultation. Right. And honestly, the virtual consultation was, for me, a much better option, because one, I trusted you because I had done so much research, and so when I sent in the photos and immediately got the response back, and then we set up the follow-up consult, it was like easier for me to drive here another time. It was just quick. It was set up the camera, take the photos, and then I have those photos still that I sent you to look back on and remember what was.
Right. Yeah. The virtual experience is it's become more and more of an option. Yeah. I think
it's a great one.
30% I think right now is doing virtually. But it's not because of COVID anymore. What's actually happening is because I'm very thankful that my brand has kind of expanded out onto the internet. And so I get patients from literally all over the world now.
I bet.
And so we do this virtually. So people from Canada and California and New York, and I'm getting people from South America now. But the virtual now has kind of changed the game. But everyone should always be reassured that it's me doing the virtual consultation with you. You're going to talk to me. We're going to have a lot of communication ahead of time. But at some point, we're going to see each other in person, and then we can kind of solidify the plans and the suggestions. Right?
And like I said, that was a perfect kind of fit for me and my situation. And now I can understand how so many people might find that to be beneficial for them.
Whole new world now.
Yeah, it is. It's crazy.
So let's talk about the importance and impact of this the procedure. And so there's a lot of women I've met a lot of women who want this surgery, and I get to meet them and talk to them, and then it is not uncommon for them to get very emotional, and the comments of I feel guilty. Like, should I be doing this for myself, my kids? What happens to me if something happens in surgery and I'm gonna leave my kids? And that anxiety, right? Is I totally get it, and I understand. I empathize with it, and I just had a conversation just a few minutes ago about this. Is that here in the United States we have probably the safest form of general anesthesia in the world. The best medicines. At least for me, your surgery's done with the anesthesiologist the whole time. That's board certified. We trust them. They work with us. Our average tenure for our anesthesiologist group is 10 years. So, I trust them to take care of my kids. I've had surgery with my wife. They did my wife's anesthesia, and I don't even think about it. To me, it's general anesthesia, and then at least patients that I'll operate on, you're going to be medically optimized to make sure you can tolerate the procedure. So I tell my patients, just rest assured that you're going to wake up. You're going to wake up, you're going to be fine, but I think in the end it's going to be worth it. But let's talk about that anxiety of making that decision. And do you tell your kids that you're going to have surgery? How do you tell them when you have young ones versus the older ones? Like, there's that interaction between
guilt,
the family.
Right?
Yeah, the mom guilt.
Yeah, the interaction with the family. Well, my circumstance, my little one doesn't care. My middle one, he is has special needs, so he's globally delayed in multiple areas. So I couldn't explain anything to him. My oldest one, he's 16, so he very much knew that he was going to have to help and knew what was going on. But I think he, just seeing my journey was all for it too, and incredibly supportive. So the mom guilt and the anxiety, because you're like, I'm doing this, is it for vanity? And then I'm, what happened? And honestly, it's just an anxiety, I think, that moms have, just like we have when we stay at work too late or something else with our kids.
It's an innate anxiety.
It's just us being moms, and it's incredibly safe to do anesthesia nowadays. I know that I had to keep telling myself, like, your little son goes in and gets anesthesia frequently. If he can handle it, so can you. So I had to really reassure myself. Honestly, when I walked into the surgical center, though, not only is it so beautiful that you're like, oh, and it's so modern, but everyone there had this just aura of welcoming and calm and confidence that I immediately had no anxiety. I mean, whatsoever. I was like cool as a cucumber. And I honestly thought that I was going to be panicking in there by myself without my husband. Like, I had more panic attack going into my C-sections.
Oh, wow.
Yes. And knowing that I would be awake in there, there was something calming about that surgical center of yours.
We take a lot of pride in our staff and the facility.
It was great.
And our staff, they love their jobs. Hopefully you got that impression.
Oh, yeah, for sure.
And they really, really take patient care to heart. And so they're all, moms and wives, and they've all had surgery. Most of them, pretty much all of them have had surgery at some point. And they understand. They're very empathetic to the experience.
So empathetic. And wanted to know about me. And that, you don't get that a lot when you're going in for a medical procedure.
Yeah.
That bedside manner, Yeah, it was great.
So, going back to mom guilt, and, I tell my young moms, especially the young ones I call them super moms, right? Because you're used to taking care of your kids, and you're the nurturer of the family, and you're taking care of the husband and making sure the house is done. But that Mommy Makeover surgery is not a small one. And I'm sure I told you the same thing, is that you absolutely will need some help that first week. You cannot do it. You're not disabled, but you're going to move a lot slower, and you're going to feel so guilty that you can't take care of your kids that first week, especially the first week.
It was
because
hard.
You're going to be uncomfortable. You're going to be emotional. You're going to have this guilt as I can't help my kids. My kids need to do that. They need to go to school this time. And you're trying to think all these things. But I can't tell you this. The support team, when you go into recovery, is so important to help you have a smooth recovery. So husband or caregiver or mom or dad or kids are old enough to help you take care. You got to start planning ahead of time.
Oh, for sure.
Because that not doing so just makes things so much more anxiety provoking, and it's so much more emotional after surgery.
And it's one thing you can control. Actually,
it's one thing you control. I can't control that for you.
Yeah.
I know I can do your surgery safely. I can get you to the protocol quickly and smoothly. But if I don't have the support system for you at home, it just makes everything go to crap.
That's one thing that I think you have to have. I mean, you have to have someone physically for a couple of days. You need it. There's, no getting around that. But you definitely need you also called it a team. I called it a team because I had my mom there and my husband, and I have a grown teenage son, teenage son. And I needed all the help. I had to quarantine myself in my room because I have little rambunctious kids who want to be running in, bumping into mom and jumping on mom, but mom's got boo-boos, so mom can't, It was sad. I have.
Did you feel guilty a little bit?
Oh, I have a video of I had to latch my door, and I have a video of my son is sticking his hand, and my middle son is nonverbal. He said, "Mama." He actually called for me, and he recognized that I was not the same mom who came back. But, sometimes you just have to do things for yourself. And I knew that it was hard. I looked at it as a mini vacation. I didn't have to change a diaper. Didn't have to get a bottle.
Good way to see it.
So I tried to look at the bright side of it. But that mom guilt is there, and you feel emotional. There's a lot of emotion going on because you can't do for yourself. Right. You can't do all the mom things you normally do. Right. You're dependent on someone. You have to ask somebody almost every few minutes for something sometimes.
Yeah.
And if you're someone who does things on your own, that is hard.
Very hard. Very hard for independent super moms.
Hard.
Very hard for independent super moms. That's what I call you guys.
It is.
But you got to do it. I mean, it just you'll make your life a lot less anxious, anxiety provoking.
Yeah.
The let's talk about like getting ready for the procedure. Did you find anything before surgery? Like, let's say we talked about visiting surgeons, stuff like that. In this society now, we have cosmetic surgeons that are not actually plastic surgeons. Did you have any? Did those kind of come across your search pattern at some point?
Oh yeah, I personally have know people who have had work
gone to Mexico.
Oh yeah,
I hear that all the time.
Oh, that's
go to Mexico, and then I hear the bad stuff. Like, they come to me because I have to fix everything, and they had all these crazy experiences. They had problems with bleeding loss, and they got trained with the hospital.
You know what I saw a lot of the doctors or the girls, especially in videos I watched of girls, but them doing the lipo of the abs with the and I see American doctors and even Australian other doctors talking about how no, you need that blood flow. Correct. That's something you do after, just little things like that. We're not doctors. We don't know anything. We're going in like, oh, my friend had it done and, she loves it or whatever the case may be. But it's like, I couldn't risk it personally.
I'm glad you did your research.
I did my research.
Super important. So
that's the most.
Patients considering, having cosmetic surgery. I hope you reemphasize that, you want to have surgery with a surgeon who's trained, who's by the American Board of Plastic Surgery, that they've gone through all the credentials, and they pride themselves in safety and patient care, correct?
Oh, without a doubt. I mean, that was definitely the most important thing on my list. I would have not had any procedures done by any. I mean, I know the place I get Botox at, they do liposuction. And
oh my gosh.
Could you imagine?
I'm going to be like earmuffs. I don't want to.
Don't. You don't know what I'm saying. No.
Yeah.
I know that's not a board certified plastic surgeon,
yeah.
but I know it's a doctor there. So, but it's scary sometimes in this world where
it really is
so desperate almost to get these.
Well, unfortunately, cosmetic procedures are. They're lucrative financially.
Oh, definitely.
And so, unfortunately, in some states, and at least the United States, is that if you have a medical license, you can kind of do whatever you want to many, many procedures, as long as you're in office. But that's the problem, is that these facilities are just basically a closet in the back of their office, and that's kind of concerning. And it's amazing what you can do under local anesthesia or twilight anesthesia. And the environment, at least for the procedures that I do, I don't really do anything under local anesthesia, significant procedures. These are things I feel that needs to be done safely, and so I always use my facility that's all fully accredited, the state of Texas, and then all these other accreditation organizations, as well as using anesthesiology during your surgery. So for me, I take care of my patients like they're my wife, and there's no way in the world I'm going to put my wife at risk for any kind of complication associated to the procedure. So that's kind of the point of that, is really about the safety and just getting better results. I had a conversation not even 10 minutes ago before you came in, is she was just terrified of general anesthesia, just terrified, did not want to go to sleep. And I just couldn't reassure her enough that, it is safe. It is a safe thing. It's safer than flying airplanes. Yeah. Flying airplanes is one of the safest things.
I don't fly in airplanes
you
anymore.
Really?
I don't. I got this anxiety after COVID, and I stopped traveling, and it's a mommy thing too. I'm like, what do I do with my 3 kids? Who do I save? No, it goes through my head. So, yeah. So, I'd rather have anesthesia.
All right. Well, that's good to know. All right. So let's go back to the procedure itself. So you got through the surgery. Do you think it was as worse as you had feared?
I was using my C-sections as like a baseline to compare it to.
Great question. People always ask me, is it worse than a C-section?
No, it's not worse than a C-section. The C-section, you have that little baby there that you also have to take care of. Although you do have some new babies sometimes after your mommy makeover. You have 2 new babies that you have to take care of. But yeah, the pain wasn't the thing for me. It wasn't really pain. It was more discomfort. lower back strain, that I wasn't used to.
Sure.
So that was difficult. And just a lot of, you're not sleeping the same. There's a lot of just when you're so used to a certain way of things, and then now you have to kind of sleep a certain way, sit up. But no, it wasn't as bad as I thought.
That's a very common sticking point for some women. Women are just like terrified. I'm about to have all this pain. It's going to hurt so bad. And so people trying to, women considering Mommy Makeovers, that's one of their, again, the sticking point, pain. What other kind of sticking points do you think some women were going before you considered having yours?
I know personally I was definitely terrified of, and I hate to say it, but that kind of stretched out tummy tuck look that you see.
Okay.
I mean, I was terrified. I almost was just ready to only do the top half and just leave the bottom half as it was, because I said, what? Even, sometimes I just was terrified of it. I was terrified of just that stretched out look. And so aesthetics played a huge role in choosing you. I'm not going to lie. Of course. Your ability to French braid hair also really played a huge role. No.
Look, if he can French braid hair, he's got to be good, right?
Honestly, as someone who likes to, takes pride in appearance, I understand a little bit of the mental state of a bodybuilder.
Yeah.
And a little bit of that, what do you want to call it? Perfectionist. That is in there. And I want that in a surgeon. Sure. Period. And I wanted a pretty belly button.
Yeah.
I got one.
There you go. Well, good. That's a great comment. Just basically the outcomes surgeons can produce. So I feel like as trained surgeons, we do things very similarly for the most part, but there is a level of artistry that I feel that, at least for me, I feel like I'm artistic, and I got it from my dad. And I incorporate my artistry and creativity into
they're sculpted, they're
bodies
beautiful.
that I get to work with. So to me, it's a form of a canvas to me. Your body is actually, this kind of sounds weird, but it is.
It is.
And so I take a lot of pride in it to make sure that you were built to enjoy it, and it lasts with you for the rest of your life. It's super important to me.
For sure. That, you want the result. I have, like we talked about with going to other places to get surgeries, you see initially the results are looking okay, but then, they just don't sustain because I don't know what it is. Maybe there's a lack of education there. I don't know what it could be, because, I'm sure doctors are all great everywhere, they can be, but there's just something about being able to create a beautiful outcome, and I just felt that I was going to get that choosing you.
Well, thank you.
I was confident that I was going to get that.
Well, thank you. Again, we're not all created equally, right?
Magic hands.
We are not created equally, but it comes down to the fit, right? So the fit of the surgeon, the personality, and the staffing, and then their artistry, whatever you want to call it, like that.
Definitely artistry.
All about the focus of safety and the recovery. It kind of putting all this together to make the right decision, right, to choose the surgeon is it all comes together, and hopefully I'm glad it worked out for you. I'm so happy to be your doctor.
Thank you so much. I am so glad
but there's so many women out there that are I get this all the time. Dr. Morales, I've been thinking about this for 5 years, and I've researched you for 4. I've seen you since social media. I've been following you for a long time. I've been saving a lot of money, and I'm just so nervous to be here. And I feel like you've answered all my questions on YouTube, and that's why we're doing this, right? Yeah. Because I want it I don't get all information to just from me. I actually want, my patients to talk about it, because you're being honest. I didn't prep you at all for this, right? We're just shooting from the hip. From the heart. And I just want to hear you be honest. And, these women were in your shoes back then. So to me, it means a lot to convey of, what was your thought process going into the procedure and then coming out of it. Do you have anything in hindsight you would have done differently?
I don't think I would have done anything differently. My husband says he would have hired a nurse the first night.
Now there's nursing homes that specialize in recovery cosmetic surgery.
Having to take care of it.
It's for those guys. I'm telling you, it's I call it putting you on staff for a week, because it's your job now, because I can only do so much.
How good are you?
How much do you love your wife? Does she deserve it? And the answer is yes.
Yes. He did great, but in hindsight, I and it's, it may sound like, oh, it's here, it's easy for her to say that, but I am so happy with every single step of this process. Maybe I would have done it sooner, but, maybe not. I don't think I was ready. I think physically I wasn't ready yet. I think I'm a little bit mentally, you want to be there too. Yeah. So, but in hindsight, other than that, I think my husband's the only one who had a complaint. Yeah. Taking care of me that first night. He said after that it was good though.
Well, after, that's great to hear, but let's talk about like the impact it's had on you now. Like I've seen you on social media. I think to me, I find it very rewarding. I don't, tell my patients, I don't expect you to be like, tagging me on everything. I don't
want to be obnoxious either. No.
But I find it very rewarding to see your confidence kind of grow and blossom, and then see how you're talking to the camera now and you're showing your body off. And because to me, what's most rewarding is that you're inspiring other people. Yes. And then people are looking at you more because you're inspiring them in like health and fitness or just being more confident in women empowerment. I'm a huge fan of that. Oh, yeah. So I think the good things that decision you made helps kind of inspire others, whether or not to have the surgery yourself, but in other ways, right? And I think just watching you.
There's a growth, that is exciting to watch sometimes. If you like to be inspired, which I do, I'm a huge on inspired energy and just surrounding yourself with as much of it as possible, because otherwise, I've been there. I've been in that dark pit where you feel a little bit desperate and don't think that, life can change or get better. And the confidence, people have been just messaging me too, even some of your patients, just like, you are beaming confidence, and just
love hearing that.
Yeah, it's been amazing, and it's emotional, because coming from a little girl who just was relentlessly bullied. I was called Sasquatch and Shamu and just terrible. Traumatizing things that really set me up for the person I am today, fortunately and unfortunately. But to be like, look at what I was able to do by just setting my mind to it. And it's not just like, quick fix plastic surgery, because someone made a comment like, you just tell all your clients now to go get a tummy tuck. Like, no, I would never, not unless they were physically in the right place, mentally in the right place.
Good for you.
There is a time and a place, and I was ready and deserving of it. And so I jumped at the opportunity.
That's fantastic. I love hearing that, because, plastic surgery isn't the answer all the time. It's not just a quick fix. It's actually, you got to think about the mental aspect of it, Yeah. I've seen women who've had, feel like the cosmetic surgery is a weight loss surgery. It's not.
Oh, no.
It's not a weight loss surgery. So they think I'm this magician. I get accused of being a magician all the time.
You're a little magical.
But, they think I have this magic wand, and then you're going to lose like 20 pounds. It doesn't work like that.
It's definitely not weight loss.
So I've had women who've gone through the procedure, and then we have the counseling ahead of time about it's not weight loss surgery. And then, things can happen in life, right? Stressors can happen in life, and jobs change, maybe a death in the family, or, change with the relationship. And then they end up gaining 25 pounds or even more. And then kind of undid some of the things that was done for surgery. So that's really the hard part for some people to fully, I say it all the time, but to fully understand.
It's a lifestyle change.
It's a lifestyle change, very much so.
Yeah.
It's so important. You need to be, I tell my patients, you have to be happy in your body, in your personal and work life, because it's so important. You shouldn't be killing yourself in fad diets to try to lose weight to have cosmetic surgery. No. And if your surgeon say, you need to get below a BMI of 35, it's not because they're being mean. It's actually we're doing it for first of all, it's for safety.
And for your results.
Yeah. But you have less complications associated to a lower BMI. So, and you're going to be healthier. You're going to live longer if you lose a little more weight.
And it's not only you, it's your family. Because I'm sure if you have some unhealthy habits that are causing you to have a BMI that maybe is preventing you from having a surgery, it's definitely affecting your family, because these are habits you're teaching them. And so, it should be treated as a reward for hard work and effort you have put in for some time. And then also, remember that it's something you have to maintain, because you can undo results. And that's why it's really important just, to learn and to make it a lifestyle and not just a quick fix, or expect that you can magically fix, especially habits. You can't magically fix habits. That takes years. I'm still working on it. So 8 years later.
Yeah. So tell me about the kind of, I guess, the new business for you. Not really new business, but you're a personal trainer. You do some coaching and stuff like that. Is that true?
So it's a little new because I changed the name and my direction a little bit.
Okay.
I started about 2.5 years ago, right around the pandemic, and I basically do a lot of behavioral behavioral change education, just to really make it a long-term thing. You may not even get a workout program from me ever. It may just be all about nutrition and figuring out how we can create better habits and make, your weight loss something that isn't just a quick fix, like we said, and something that's going to maintain forever. And you're going to be able to learn how to put your workout programs together, and you're going to be able to learn how to take it with you, because we can't keep you in our programs forever. I mean, maybe we want to, or some people, but personally, as someone who struggled and hired multiple trainers and got nowhere, I said, what did that person want and need in a coach, in a trainer? And that's what I'm giving it. I needed education. I needed somebody to really educate me and not just give me this quick fad fix crap.
Love it.
Yeah.
So tell me how rewarding it is to see people go through your
I just got a text.
Just the impact you make. Isn't it the most rewarding thing ever?
I know how it is. Yeah. I mean, and you're beyond, yours got to be beyond, but I got a text this morning from one of my clients, and she just she's been following some training programs because she's been working for a year on just her nutrition, and now she's finally ready to work. So she's been working since January. Of course, January brings on a new motivation. And she just messaged me like, I feel so great. I don't like to say how many pounds she's down, but I'm down weight, etc. And just, feeling amazing. And she already was feeling amazing, already down weight, but now it's like a new form of this journey that she's on. And she's not rushing it. None of them. And that's what I instill in them. If you want to rush it, go find an 8-week challenge. If you want to just, really learn, I'm the one for you. And so, when I get those messages and I get those before and after photos, it's like,
it's cool stuff.
Yeah, it's life-changing for people, and it's life-changing for me. So,
the lifestyle change is just cannot be
it's
talked about enough.
Pounded in.
It is really just changing everything about your lifestyle, and it comes down to nutrition and exercising, in my opinion.
Yeah, and you can still, I still enjoy everything that I used to enjoy. There are levels, of course, like, of how intense you want to get with it. And, I'm not a bodybuilder. I'm just someone who doesn't want to go back to being 100 pounds overweight,
Love it.
And so let's learn how we can make it work for everyone long-term, sustainably. Sure. Yeah.
To me, it's especially the younger moms, I would say, with younger kids, and seeing they're overweight and going through that journey, and then they lost the weight. The way they take care of themselves, it's being watched. Your kids are watching you. Oh yeah. And they're just they can't buy their own food.
You're the one.
You're the one doing it, right? So I see it as a responsibility to your children to eat a little bit better and just kind of instill some of the foundations of
100%.
Of nutrition and maybe some exercise routines into just a family life. I can't emphasize that enough, that you gotta,
it's a good thing.
You set the tone, really, and hopefully, my kids don't work out like my wife and I do, and by any means.
Like you said, there's levels to it.
Yeah, but there's levels to it. But they see us, and hopefully when they get out into college, they start kind of realizing, like, hey, I know what mom and dad did, and then, maybe they'll kind of get a little more religious with it. But for us, Corey and I, it's something we do every day, and the kids know we do it every day. They don't really see us doing it just because we train in the mornings, but they know mom and dad we don't eat junk. Yeah. There's no junk in the house for mom and dad. But it comes down to choices, right? Right. And no one's making you eat that bag of Doritos watching TV.
That was me. That was my life. And that was the one thing really had to instill in myself, you are in control, Yasmin. You are the one doing this. You are the one who's going to be able to change it. And, you know, it's hard, but it's easy at the same time.
Rewarding, and it's all worth it.
Yeah. Oh, God.
It's all worth it.
Beyond worth it. Because it's not only you affect your circle, too.
Yes.
So it's not just me, my family, my sisters, you know, everyone is impacted by this. My parents, so, you know, it stretches beyond. It ripples.
You become an ambassador of the lifestyle.
Oh, yeah.
And
then it motivates you to keep it up.
Yeah, it just keeps going, right?
Yeah.
And then you inspire others, and then people tell you that you inspire them, and the next thing you know, you want to do even better.
Yep.
And so that's what I see in you, is that you're kind of inspiring others, and I'm just so proud of you for everything you've done so far, and I think you're going to continue to do some great things.
Thank you so much.
So it's I'm just so thankful that you came out and talked to me about this.
Thank you. I am so happy you invited me. I was a little nervous because I didn't want to cry. but you know, I'm happy I could share my story with everyone, because I know that it's hard, but if you're contemplating it, it's definitely going to be the most rewarding thing you can do for yourself and for your family.
Very much so.
They see it.
Yeah.
They see the confidence.
It's all about comes down to confidence. That's really the magical word for me. It's always confidence.
Confidence takes you far in a lot of different places, and it's not even about an arrogance. It's really about, you know, a drive within yourself that it brings on.
Yeah, love it.
Yeah.
Well, where can people follow you on social media? I want to hear. Let's talk about your handle.
Oh, this is so exciting. No, we can find me at Yasmin Aesthetic. That's my Instagram handle, where you just see all of me and my personal stuff. And my business, Your Why Now. Those are both Instagram. I'm not big on TikTok and all the other things. I try
YouTube yet? Have you done YouTube yet?
I do have a YouTube that I was really active on for a long time, and then mom life happened and just get busy. But, you know, I'm trying to get really consistent with doing more things to help people, and I know that the videos and stuff that I do try to put out do. So I'm going to get better. You'll see me.
You're doing an amazing job. Congratulations.
You so much.
Thank you so much for coming.
Thank you
appreciate
for
your time.
Me. Of course.
And go follow her on Instagram.
Thank you.
Thanks for following. If you like this content, please don't forget to like and subscribe. Post a comment in the comment section. Love to hear what you want to hear about next.